Manager for the Partnership for Maternal and Child Health of Northern New Jersey, which is providing today's program. Our webinar today is titled Bereavement Care After Perinatal Loss, the Role of the Postpartum Doula. I would like to review some information before we get started. The planners and speakers do not have any financial disclosures to make. Immediately after the webinar ends, as well as in an email, you will be invited to take a post-program evaluation. We appreciate your feedback, so please complete the survey. To receive a certificate of completion, including one nursing contact hour, you must log in, listen to the entire webinar, and then complete the evaluation survey. Certificates of completion will be sent via email 1 week after the webinar broadcast. This program is being recorded and will be available on the partnership's website until October 2023. We will be muting all attendees' microphones during the presentation, but we would love to hear from you. Please write questions in the question box and speaker will respond to as many as possible at the conclusion of the presentation. Now I would like to introduce today's speaker. Today's speaker is Chanel Porchia-Albert of Ancient Song Doula, founder and CEO of a community-based organization, International Doula Certifying Organization, founded in the fall of 2008 in Brooklyn, New York. The goal to offer quality doula services to women of color and low-income families who otherwise would not be able to afford doula care, centered in reproductive justice and justice birth framework. Chanel has worked on numerous advocacy projects centered around legislative policy on Medicaid reimbursement, reproductive health, and human and civil rights within childbirth. Chanel's work has expanded to provide consultancy to various organizations, the intersections between human rights and reproductive justice, and policy that affirms transparency and accountability measures with hospital-based institutions. Chanel has been featured in various publications such as the New York Times, Self Magazine, Center for American Progress, The Hill, Rewire, and various documentaries by Vice News, Death by Delivery, The Root, Elle, and Vogue magazines, and more. So please welcome today our guest or speaker, Chanel Porchia-Albert.
Thank you, Andrea, for the wonderful introduction, and greetings, everyone. Happy afternoon. I'm hoping that your day is going well and that you are centered and cared for. Before we even get started and I get into the presentation, please make sure that if you can be, you're in a relaxed position, you're in a comfortable environment, have your tea and everything ready. And I look forward to your questions at the end so that we can interact and see how we can build and sustain community around the role of the postpartum doula in centering perinatal loss. All right, so the overview. Today I'm going to talk about just the current landscape, the role of the postpartum doula, centering hope, the use of ancient technologies, and provide some resources for you all to use within your everyday practices and lives. As a disclaimer, I just want to let you know that I have no financial constraints or disclosures to mention, as Andrea mentioned, and so just wanted to make sure that was in there to reiterate. All right, and so I want to start off with a quote from Toni Morrison that states, "When there is pain, there are no words. All pain is the same." And so understanding what it means when we're talking about the perinatal loss and someone experiencing pain, I think that we have all had moments in our lives where we have experienced a loss of some sort. And that pain sometimes has no words. The current landscape, evidence of where we are and where we need to be. So perinatal loss is the loss of a baby during the pregnancy or delivery. It's common experience with as many as 10 to 15% of pregnancies ending in loss. The types of loss that someone can experience are centered in infertility, so difficulty conceiving, a chemical pregnancy, so the loss before 6 weeks gestation, miscarriage, loss within the first 20 weeks of pregnancy, and then stillbirth, where it occurs after 20 weeks or during the childbirthing period. But I also want to talk about the external conditions that can contribute to perinatal loss. So the allostatic load from stress. And so when we look at weathering on the body, in particular, when we're talking about Black, Brown, and Indigenous peoples, and that allostatic load and how it is presented Also racism and bias within the healthcare infrastructure. And so understanding the intersections of what does it mean for someone to show up in an emergent situation, maybe experiencing a loss and not necessarily being able to be cared for in a way that centers them, or thereby going to access a prenatal visit or aftercare and finding out that they have experienced a loss. Or the loss is as a result of the racism and bias that they have experienced within the healthcare system. Police brutality. And so really want to also talk about how violence and unprovoked violence in our communities, and in particular communities of color, can contribute to the allostatic load of stress and how our body responds to a pregnancy. Environmental injustices, and so climate change. If we think about recently the things that have happened in regards to massive flooding, wildfires, people having access to clean water, all of that contributes to external conditions. Concentrated poverty, right? And so if someone lives within a concentrated poverty area, they are more likely to experience these external conditions play a role in their perinatal outcome. Unequal educational opportunities in the ways in which people receive information. So is it at a literacy level that someone can understand? Is it at a language, in a language that someone can understand, right? Is someone taking the opportunity to really explain to someone in a way that they can really digest the information that's being presented to them so that they can make an informed decision about their care? And then neighborhood safety, right? The neighborhoods that we live in, and the safety that is there also plays in a role in the resources that we have access to, right? And someone may say, oh, but you have resources, but resources doesn't necessarily mean that you have access. And it also doesn't mean that those resources are given to you in a culturally humble framework, where you're really centering what it means to be in community and be an extension of that. And so the numbers, what does all of that mean? That means that 10 to 15% of pregnancies that are confirmed end up in a miscarriage or a stillbirth. 80%, the approximate number of miscarriages that occur during the first trimester of pregnancy, and 1 to 2% of pregnant people experience repeat miscarriages, which is defined as 3 consecutive miscarriages in the first 20 weeks of pregnancy. And so I really want us to understand what that means and just think about how if racism and implicit bias was playing a role prior to the pandemic, and now we're in a pandemic, thinking about how these numbers may even shift and change, right, as we are continuing to center one another in a community care framework and really trying to address each other's needs while still understanding that those things haven't stopped, okay? And I think that's where the full spectrum community-based doula comes in centering how care happens and really what a community care framework can look like. So community-based doulas lead with the understanding that choice, access, and informed shared decision-making in pregnancy, childbirth, and reproductive care are central to improving outcomes. Listening to and valuing the autonomy of pregnant people guides supportive responses. And so basically what it means is that we're meeting people where they are, not where we expect them to be. So imagine you're going into your care provider and they're taking a moment to take a step back and say, you know what, before you start to talk to me about what's going on with you, what does this mean to you? How can I best support you in your process and what's happening right now? It's centered in a human rights framework, understanding the root of racism and discrimination. We're centering a culture of care and the intersections of health and racial equity, and understanding that within the framework of perinatal loss, that doesn't end. We're addressing intergenerational trauma and how that trauma plays out in the body, but also on a physical, emotional, and spiritual level. We assist in the development of a reproductive life course plan. So what does it mean then for folks to be centered in their care in the immediacy, but then continuing forward? And that means that we're adopting a life course perspective, and we value community as stakeholders. So it's not just about us saying what someone needs, it's about us really listening to the voices of the community and those who live in those communities, and understanding that our communities look very diverse. If we look at New Jersey and the population that we have here, we have huge populations and pockets of individuals who are undocumented, those who may be incarcerated, those who may have child protective services cases, individuals where English is not their first language. And so in understanding that, and then various different religious and cultural beliefs, right? So then what does it mean to really talk to the people who live and work in the communities every day and get a clear understanding of what does support look like for you? Right? And how can we continue to build that up in a way that centers equity and accountability for the systems that you go and you interact with every single day? And that's how we're valuing collective models of care, understanding that it's not about just that episode of care that is happening at that particular moment. It's everything, right? It's how we as a community, meaning the doula, the nurse, the midwife, the OB, the social worker, the grandmothers, the aunties, how we're all coming together to really center what it really means to work collectively and center care for that individual and or family. And so postpartum doulas are trained to provide non-clinical, emotional, and physical and informational support, centering the parent through infant feeding choices, their self-care resources, healing, and the process of reproductive outcomes. So we're really sitting with someone and getting to understand what does support look like for you, and how can I best support you? And then we're creating goals, understanding that what someone may be presenting at that particular moment may not be what they need 2 weeks from now, a month from now, or 3 months from now. When we're centering loss, in the event of a loss via miscarriage, stillbirth, or chemical pregnancy, a postpartum doula will assist the individual in processing the event, centering culturally humble and responsive resources, supporting in the grief process and what that looks like for the individual, and connecting them to mental health resources and other methods for centering self-care for themselves and or their families, right? Understanding that the loss of a child is not just an individual loss, but it's a collective loss. It's a loss to the family and the immediate family, but also to the community, and can have huge impacts on the ways in which people navigate systems. So we really want to work from an integrated community care framework, understanding what it means to really bring in the local area, so space that's structured, using the resources that we have and technical assistance, incorporating people's lived experiences. We're looking at psychosocials, and so what does it mean to give someone the tools that they need to empower themselves, that is fostering social participation and increasing social capital so they feel like they're getting the necessary supports. We also understand that certain support is temporal. And so in understanding that, then what does it mean to have those care plans or goals that are structured and organized to meet their needs across a span of time? And it needs to be within proximity of where someone can get to. So we're looking at visibility, we're looking at outreach and connection, geographic accessibility, transportation, language. And we're doing that from a collaborative care framework, right? We're in partnership with community members to really center a community care in action, right? So we're understanding that it has to be intersectional and cross-sectional for folks to be able to feel like they're actually being supported in the care that they're receiving. So the postpartum doula, in addressing the symptoms of loss, we're looking at the physical symptoms of loss, and so how grief can follow a perinatal loss. So sleeping problems, working with individuals to center a sleep schedule that works for them, developing exercises where we're working through that process, appetite loss, stomach problems, fatigue, feeling weak or run down, and tight muscles, right? So understanding like a lot of times when we're talking about stress or how one is coping, some of that is felt through the systems of our body, right? Do we have tight shoulders? Do you have a tight lower back? Do you notice that your gait has changed? Maybe your posture is different, right? How we're presenting ourselves to the world, how we're carrying ourselves feels different. We're working with folks in understanding the 5 stages of grief. And so denial, where someone may be overwhelmed, in shock, or numb. Understanding how anger can present itself at any stage within the grieving process. Having anger towards themselves or other people, or a higher power. Or they may try to assign blame to individuals. So maybe it's the institution or their care providers or even their doula, right? As trying to find a way to focus their energy on what does this mean, right, for me moving forward. You may be bargaining, right? Bargaining stage is where someone may be having overwhelmed thoughts. Maybe if I would have done this, then this wouldn't happen. Maybe if I attended more prenatal visits. Maybe if I took, I rested more and centered more self-care. Maybe if. And so we're understanding and working with people to understand that guilt and shame will evolve, and that all of the feelings that they're feeling are completely normal, right? Depression, and where people may show signs of sadness and crying, that can affect their sleep and appetite and poor motivation. And understanding that depression is not something that is a one-time episode. It may be something that is continual. So what are we doing to navigate that space? And then acceptance, right, which is the goal of grief, right? And that's when a person has reached this stage, they have accepted the loss and possibly found some meaning in it, and what that looks like for them. But also understanding that they may continue to feel sad, right? Or as they speak about it, or memories or triggers can bring forth a response, right? And so the postpartum doula is working with them to understand that, excuse me, and what that means. But also, the physical changes, right? So what does it mean for the individual who is lactating? Maybe they don't want to lactate anymore, and so providing the resources that they need to be able to do that. Or maybe because they've experienced this loss and they are lactating, they're like, what if as a way for me to process my grief, I can continue pumping and donate my milk to maybe children, preemies or a donor bank, where someone can use this, my grief as a way to fulfill some sort of joy and happiness in someone else's life. We're centering mental health and loss, and so depression, anxiety, and post-traumatic stress disorder that may result as a result of multiple losses, non-support from a system, and previous occurrences of depression, anxiety, or PTSD, right? And the intersections of that as well, right? And so understanding how social factors can also coincide with that. And we're doing all of this while centering hope after loss. So we're looking at key considerations, families, providers, community, and creating a network of support. And Bell Hooks says, "It is my deep belief that in talking about the past and understanding the things that have happened to us, we can heal and go forward. Some people that believe that it is best to put the past behind you, to never speak about the events that have happened, that have hurt or wounded us. And this is their way of coping, but coping is not healing. By confronting the past without shame, we are free of its hold on us." And so what we're really trying to do is we're trying to allow people the freedom to be able to grieve in a way that feels good to them. We're not putting a timestamp on what that looks like. We're meeting them where they are, not where we expect them to be. Understanding that grief is continual. As someone myself who, in setting up for this presentation, I actually was talking to my sister, and I was asking her, I was like, tell me a little bit about your experience with grief. And, I supported her via phone when she had experienced a stillbirth. And I remember just the ways in which we centered her being able to get a stuffed animal that ended up being an urn, so that she could hold on to and be able to have until she was ready to move from that, if she wanted to or not. But in having the conversation, I also found out that what I didn't know was that she had experienced 7 previous miscarriages before she actually had my nephew that she has now. And just thinking about the ways in which that shows up for folks. And as we were discussing, that grief was still fresh for her. That was something where she brought up to me, she was like, when you suffer a perinatal loss, like what happens to us being able to get support in terms of FMLA? Like, she's like, because I didn't have a physical child that came from a pregnancy, I was still required to go back to work after my stillbirth, after a week's time. And I had no other choice but to comply, right? And so what happens to folks who maybe don't have the additional support to be able to stay home from work for a duration of time? And even though the pregnancy didn't result as a live birth, these are still people who gestated for a period of time. These are still individuals who have experienced this connection between this fetus that has growing within them, right? And so what does it mean for us to be intentional about creating these networks of support for individuals to be able to process even over time, but also holding systems accountable for understanding that grief is not something that happens that's like a momentary thing. So some of the things that we want to consider is the social determinants of health, and so how housing, transportation, and access to goods and services has a deep impact on how someone is able to grieve. Intergenerational trauma, and so the traumas that we may have heard from our grandparents, our aunts, and others who have experienced loss, and how that loss can also magnify our own personal losses. We need to be moving from a trauma-informed perspective, right? And considering possible triggers to an individual when we're having these conversations, when we're building care plans with individuals, right? When we're censoring what it means for someone to navigate through a system. We want to consider previous birth trauma, right? Or the trauma that has occurred within that particular incidence of care, or previous sexual trauma, as well as does someone have a network of support in place? And so a network of support can be a friend, or it can be immediate family, but sometimes it's often also working with folks in creating a network of support and being intentional about that. So what does it mean for someone to, have a meal train so they don't have to think about eating, or if they have other children, or just to care for themselves? What does it mean for folks to set up a phone bank where you're doing mental health check-ins with someone, or coming over and just like saying, hey, what do you mind? Would you mind going for a walk, right? Or setting up a self-care moment where someone can get a massage or be connected to a support group. We're understanding the roles of family in creating and navigating a network of support, and that's not easy. It's not easy, especially when they too are grieving at the same time. And so what does it mean to move from a place of non-judgment, where we understand grief has no timeline, so we're being patient and we're being present in the moment, where we may be collectively seeking counseling, or centering counseling for the individual and therapy. We're finding clergy or a spiritual leader or a spiritual center to uplift us during our time of loss. We understand processing can happen in various different ways. So when we're offering up suggestions, we're doing it in a loving and affirming way, but we're also being understanding if someone decides that they don't want it, right? And we're honoring their memory. And so what does it mean for us to create a memory through a photo, or through a ceremony of sorts, where we honor that loss, through a candle ceremony, whatever that looks like for the person, but being able to guide that and be supportive of that, and be open to the process and whatever that looks like. Providers. What providers can do is we can build positive encounters that are built on trust through small interactions that can help if things get difficult later or complications arise. We're trauma informed, so we're considering those verbal or physical triggers to someone. And we respect the knowledge and experience that individuals bring to their care. regarding their bodies, their history, what works well and what doesn't work for their specific case, right? So we're really working from a cultural humility framework that addresses the emotional colonization that folks often feel when they're seeking out care. And this is especially powerful when we're talking about those who are within Black, Brown, and Indigenous communities, where they can feel like this emotional colonization adds up to someone being overpowering, dominating, taking away their autonomy by manipulating or disempowering or judging them. So not allowing people to trust their intuition, maybe interrupting them when they're trying to share a personal story, acting dismissively when they do, ignoring or dismissing their emotional state, fixing their problems for them and taking away their power to fix them themselves, taking over their emotions and feeling them deeper than they do. Maybe over-explaining things, assuming that they can't understand otherwise, and worrying about them in a way that implies that we don't trust them enough to look after themselves, right? And so we're moving away from this emotional colonization and we're working from a decolonized framework that says, what does it mean for us to meet people where they are? And I'm going to keep reiterating that because it's super, super important for us to really integrate that into our everyday lives and meeting people where they are, not where we expect them to be. And that's hard, right? Because we've learned so much information and we want to be able to use it, or we want to just be able to assist and help in any kind of way. But the best way that we can possibly do that is by listening, by sitting with someone, by taking an opportunity to hear their story and what that means to them, and then building out from there to offer sustainability. And so when providers are communicating with families, we're using words that are simple and straightforward. We're not saying this is best this way, it could be worse, you can have more children, time will heal. We're working from a place of empathy versus sympathy, right? We're not using medical jargon, right? We're not arguing with others in the room. We're not avoiding questions. We're being straightforward. We're being transparent. We're having accountability for the moment and what's happening in that moment. And we're moving forward from a real human-centered approach where we're seeing the humanity in the other individual and we're reflecting that back. Because community is only as good as how we all work together, right? And so in understanding that, we understand that as care providers, we're an extension of the communities that we work in. And so that extension means that we're helping families, creative families or biological families, in strengthening their goals through processing grief and loss. We're an extension of those systems and resources. We're working to combat isolation and uplift spirits. We're centering the immediate period of loss, but understanding that that's also continual and is ever evolving. And we're assisting with other children. So if someone is having a loss and they have other children, and what does it mean for their children to understand that and to be able to feel centered within that care as well? And we're providing that continuity of care. And we're doing that through the resources that we're providing that are culturally humble and congruent, that are centered in understanding the process is continual and ever evolving, and we're meeting people where they are, not where we expect them to be. And we're also incorporating ancient technologies of healing, right? What does it mean for us to meet, to work from a place of, in a state of being, right? That understands holistic approach such as meditation, being able to sit in quiet, acupuncture as a tool to deconstruct and remove stress, using herbal technologies and talk therapy for folks, and then having those resources, right? So if someone wants a therapist of color or someone who speaks in a different language, being able to provide that, using art therapy, support groups, community talks, right? Hosting a community talk or support group or a panel that, like this one we're in right now, that offers resources and education for folks to feel like, okay, there's not only one way to approach the situation. That is centered in culturally humble providers using food therapy. Food has a way to heal, and we oftentimes forget about food, but we all like to eat, right? And so what does it mean for us to use food as a tool to be able to connect one another, right? To center cultural identity and to be able to decompress using sound therapy. So like singing bowls, chimes, aromatherapy. So like a lavender, things like lavender or bergamot or patchouli, right? And then also pelvic floor health. Like we forget about these other therapies that are available, but when someone has experienced a loss, that doesn't mean that they, their body is still going through the postpartum experience. They still need to be centered the same way a postpartum individual has, right? And so staying away from drafts. You want to be midwife that I work with, that I was trained by, midwife Shafia Monroe, says we're closing the bones, right? Understanding that someone has lost iron supplies, right, from blood loss. What does it mean to replenish that, right? And that's where that food therapy comes in. That's where the herbal therapies come through. What does it mean to if someone had a stillbirth, they still have had to physically pass a child through their body, right? And so what does it mean for them to center their pelvic floor health during that period and have the necessary resources to be able to do so? Again, lactation resources. And so having lactation consultants to be able to talk to them about what does it mean to move forward in lactating or not lactating. What does it mean to have those mental health resources in place to be able to approach situations and have a care provider who is not a mandated reporter either, right? Understanding how some people have apprehensions around that because they're afraid of how someone may be characterized in their care, right? Understanding how, again, how racism and implicit bias shows up. And so us using these other modalities that have been proven to have successful results in care is important. And this is where we're centering hope. We're meeting people where they are, not where we expect them to be. And that's my thing, because I believe postpartum is forever. And even though you have experienced the loss, you're still in the postpartum period, right? You're still in this space of navigating all of the different things that can come up emotionally, physically, and spiritually. And some of the resources that folks can connect to is like Shades of Blue Project, which centers maternal and mental health resources. It's a wonderful connection where folks can come in and they can attend classes, they can speak to a one-on-one provider. These are folks who are moving from a culturally humble perspective. They have providers of color that speak various different languages. There's Salini Institute, which is actually located in New York City, but they offer virtual support groups, and some of them are free, as well as for teens. There's a New Jersey chapter of the Association of Black Psychologists as one, and then doulas, right? And I, happen to put up Ancient Song, but also other community-based doulas, right? So depending on where someone may be located within New Jersey, being able to access a doula to be able to provide that postpartum support. And in particular, community-based doulas, right? These are doulas who live and work in those communities, who know what's going on in their neighborhoods, who speak various different languages, who are of various different identities, who are able to like really meet people and understand what it means to incorporate those social dynamics of what can be happening in the grief process, but also the physical and the emotional aspect of that. And there's many more different resources, but we also want to make sure, again, when you're providing resources, like please always like ask, follow up, check in with the resource first before you refer out, see what they have available, connect, make those partnerships. And then if it doesn't happen to be, available within your community, then create it. Like, what would it mean for us to have this dream space, right? Where we're also creating that which we want to see, right? And understanding that we may not necessarily have the immediate resources, or maybe they're not affordable, or whatever the case may be, but everybody should be able to have, equitable care that is centered in a framework and in a way for them to be able to understand. And it's our responsibility as community members, as care providers, as those who maybe have experienced the loss ourselves, to be able to connect the dots and create that in meaningful ways. I want to give thanks to all of you for attending today, and I'm open to answer any kind of questions that you all may have in regards to loss. And there's also sources that you can find in regards to evidence-based information and how it can support in a perinatal loss.
Thank you, Chanel. That was a great presentation on all the doula services. I really appreciate all the information that you provided for us. I'm going to just wait a few seconds and see if we get any questions from the audience come through. See if they've sent me any questions yet. Okay, I have a question for you. How are doulas received by the healthcare professionals in the hospitals and clinics? Are they well received?
I think it varies, and I wouldn't necessarily, it's a varying situation, right? There are some institutions that are really open to and really progressive when it comes to understanding the role of the doula, especially community-based doulas in centering individuals' care. And people I think there's sometimes a lack of understanding. And so, just speaking for Ancient Song, and what we've tried to do is we really tried to be intentional about providing education to providers through grand round sessions on like, what is the role of the doula? What does that mean in addressing the external influences that can happen, as well as racism, implicit bias within care, and then working, from a true collaborative care framework. So like, what does it mean for us to, have those connections, understanding like, you can't necessarily be with the patient for a long period of time, but if we're that extension of that continuity of care, where we're doing home visits, where we're, spending extended care with the family, us working together it builds a better outcome overall, emotionally, physically, and then the way in which someone feels about their outcome. So yeah, I think it varies. I think that, again, there's some folks who are really out there who are being very progressive about shifting the frameworks that have previously been in place, really wanting to tackle maternal mortality and morbidity and the high rates of loss as well, and what that means across the board.
Okay, thank you. I have another question. Do doulas refer clients out to other resources? And if you do, what are the main resources that you're referring the clients out to?
Ooh, yes, we do. And it varies case by case. So here's the thing, because we're creating individualized care plans for each person, and in particular, because we do a demographic and psychosocial with folks, just capturing that information ahead of time, it could be anything ranging from housing to food insecurity to mental health resources to childcare, right? To, how do I find a pediatrician? How do I find a lactation counselor? How can I navigate my insurance, or trying to get on insurance or WIC? So it could be a various modalities that people are referring out to. I think what's most important is the intention of creating those partnerships. And so, seeking out those resources ahead of time. And that's what we try to do, to try to build those relationships so that when we are referring, the partnership has a clear understanding of what like our core values are as doulas, and being able to, center a network of support.
Okay, thank you. I know earlier in the presentation you spoke of trauma-informed care. So what are some examples of trauma-informed care considerations?
So like I said, I think I said previously, like just looking at possible triggers that can occur. So like, someone may want to show a picture, right? Or even a color, or there may be a word that may spark something in someone. And so again, like we'll have a conversation with folks about possible triggers and strategies for coping with them ahead of time. So we go through a list of, what possible triggers could be so that we can be able to work with families on those. And we do that throughout the spectrum of care. So we do that prenatally. We also do that, so we know what can possibly arise during the prenatal period and during childbirth. It also helps to mitigate the postpartum period. So in the event of a loss, we have a framework of understanding. And then we talk to the families about that too, in ways that they can, they can understand. That involves, like, again, various different holistic, aspects. So using art therapy, using talk therapy, using food as a way of healing, to be able to navigate that.
Now, in the situation of a perinatal loss, how does the doula go about incorporating the entire family into the process and not just the individual who experienced the loss?
So I think it's about understanding that it's not just a loss. We understand it's not just a loss for that individual, you know, it's also a loss for the family, right? And so we might have a group meeting, right? And have conversations around what the support look like for you, you know, starting off with just that. You know, we may give possible ways um, to set up a memorial if they would like to. So for instance, I had a particular person that I worked with who had experienced a stillbirth. In the process, you know, I was there from beginning to end, and it happened in an emergent situation. And this is where, you know, when it happened, um, because it was an emergent situation, I wasn't initially allowed in the room, and I was standing at the door, but I would like talk into the room and say like, listen, I'm still here. I haven't left. I'm not leaving you. And then as soon as I was able to come into the room, I did, and I stood at bedside, and I didn't say anything for a moment. I allowed them to like have the moment that they needed to have. And sometimes our support doesn't necessarily come in us saying or doing anything. Sometimes it's the presence of knowing someone else is there. And they asked, can they bring the baby over? And she said yes. And she held the baby and she named the baby. You know, we took a moment to honor that child that was there and to honor the moment that they were having. She said she wanted pictures, so we assisted in, you know, taking pictures. When she came home, I helped to assist her and the family in creating a memorial service that they wanted, and being able to like make phone calls for the family and, you know, connect other relatives and, you know, kind of like so that they wouldn't have that extra burden of having to do all of that on their own, because that's a lot to like go through. And then I also gave her crystals, right? So I gave her 2 healing crystals. It was a rose quartz crystal, which is supposed to incorporate love, and then a clear quartz crystal that is centered in like whatever you need at that particular moment. And at that particular time when I gave it to her, I said, listen, if you lose it, it just means you don't need it anymore, because you never want to give somebody something while they're in the grieving process and then they lose that thing and now they have to grieve another loss. And so when she did lose one of them, she was like, wow, she's like, you know, I really realized that, you know, I don't need that anymore. And we still continue to talk, you know, to this day. And, you know, the first year on the memorial of when it happened, you know, we went out to lunch, we talked. I ended up, you know, supporting her sister in her pregnancy, because she was like, you know, I really love the way in which you supported our family when we were experiencing this loss and centering my sister. And so like, you know, we're creating connection, we're creating community, we're creating lasting bonds through that process, you know what I mean? And it also, again, it depends on the individual, because some people will want all of those resources and then some folks won't, right? They'll be like, you know what, I'm fine. I just want to manage that the way I want to manage it. And that's totally fine too, right? So we may offer them just resources and then just check in, you know, every so often, say, hey, you know, I just wanted to check in and just see how you were doing, you know, and see how things are going and just work from there.
Thank you. I have another question. I work in fetal and infant mortality. So a lot of times when I come across the client, they're already post-loss, and they've already experienced their loss. And a lot of my other colleagues that might be on this call are maybe a social worker or nurses or someone who hasn't met the patient prenatally, but they encounter the patient post-loss. Is it too late if the person wasn't enrolled with doula services during the prenatal period to refer them to you in the postnatal period?
No, not at all. Mm-mm. It's highly recommended, right? Because if you happen to meet someone and you think that they could use the support and the resources, I mean, that's the time where we come in at, you know, to be able to do that and to provide that support. So no, there's no time limit on that.
And one last question that we have is that how does someone apply for the doula services? And then, like, what are the costs associated? Does insurance cover this? And how is it funded or paid for?
So when it comes to our organization in general, We offer free low-cost doula services, and so we use the WIC poverty guidelines as a tool to be able to distinguish who gets, how services are allocated in regards to that. We also are grant funded, so we receive grants from various different organizations to supplement that. So we're able to pay doulas for the services that they render, and then the individual is able to get the services for free. And then, within New Jersey, they have the Medicaid doula pilot program that is currently being rolled out, where doulas can provide support and services. And so there's various different pathways for people to be able to get services. And our thing, excuse me, our motto is we never turn anybody away. So regardless of, financial situation, I believe that you should be able to have the services that you need, you know what I mean? And be able to have quality care.
Thank you. Well, that's all the questions we have so far. If there's anyone else that has questions, feel free to put them in. The text box and question box is still open. And if we don't get to answer their questions today, I'll forward you the questions later, and maybe we can get the responses out to the person. But as of right now, that's all the questions we have for today. So I just want to give many thanks again to our speaker, Chanel. You did a really great job. We really appreciate it. And I'm much more informed of the role of the postpartum doula, especially in the area of perinatal loss. So I appreciate that, especially now it's during Perinatal Loss Awareness Month, and there's not a lot of awareness that what doulas do in the perinatal period. So, the post-loss period for perinatal loss. So we just want to thank you for coming today, and thank you for your presentation. I also want to thank Karim Amadeo. She's behind the scenes. She organizes our technical support on the back end of the program. And everyone who's joined us today, we just thank you for joining. We really appreciate that. And just a reminder, you'll receive a link to the PROS program evaluation, and your feedback is important. So take the time out to complete the survey after, and your certificates of completion will be sent via email, whichever email you provide on the evaluation. So make sure that's correct. So you should receive it in about 1 week after the presentation. A calendar of the partnership's upcoming virtual programs can be found at www.pmch.org under the Professional Education tab. And we also offer on-demand recordings of many of our programs, all of which are listed on our website. We thank you, and we hope that you can join us again for the next event. We do have another part of our 4-part series next Wednesday from 2 p.m. to 3 p.m. on October 21st, I think it is, next Wednesday. So I hope you all can join us again for the next part of our series. And thank you for joining us today.
Thank you for having me.